said, and I quote, "The greatest wealth is good health." Yes, and with that, I say welcome to today's edition of ILERA EKO Extra, your one shop where we give you everything, all the information that will, of course, help you access quality healthcare at very affordable cost. Almost nothing, actually. You're welcome. My name is Akan Usen, and it's a packed show today. So much for you. If you're listening for the very first time, it's ILERA EKO Extra, and the show comes up every Monday at around 10:15, thereabouts until about 11. So make it a date. Every Monday at 10:15. Keep it locked on 96.1 Lagos Traffic Radio, and do our best to make sure we give you all the information you need to help you, enjoy quality healthcare at very, very affordable cost. And as the show progresses, we'll also afford you with traffic information to help you navigate in and around the ever-busy Lagos metropolis. But of course, with the information we give you, you will always find your way through. All right, so we have a guest in the studio. I will be introducing her pretty soon, but just to give you a bit of information as regards the traffic at this time. So straight away, I'll give you this one from the Abulegba axis, where vehicular movement within that zone at the moment still looking really good. Generally, except a bit of a delay being experienced around the Ilebo end, and this is just due to commercial activities. If you apply that end, you'd understand what I mean. We also have pedestrians crossing, but I understand it's really nothing to be worried about. We have traffic managers on ground doing their bit to make sure traffic moves on both the main carriageway and the service lane, the BRT corridor. No impediment around that end. That's how it's looking like around that end. I'll give you further updates even as we welcome our guest on the show. All right, so with us, we have, of course, we're talking ILERA EKO, expanding drug access, and we have a pharmacist with us. Yes, we have pharmacist Tonlashi Adeoluwa. Yes, she is a medical supply and logistics officer with Lashma. Yes, you're welcome.
Thank you so much.
Great to have you on the show. And okay, so this is your forte, the drug part, and we always have listeners call in with questions as regards drug access to drugs. Is this one covered? Is this one not covered? How do I know? Why is this one like this? So I'm glad that Lashma afforded us this opportunity. So dear listener, do take advantage of this. All your questions and concerns as regards drug access, of course, it will definitely be addressed today. So feel free to call in on the show, 080-991-20777 and 091-538-77127. All right, straight away. We're going to be having, let's just talk a bit for the benefit of those who perhaps do not have an idea what we're talking about. Can I ask, what is ILERA EKO?
Okay, so thank you so much for having me.
Yeah, great having you.
So ILERA EKO is the Lagos State Health Insurance Plan for Lagos State residents to be able to access quality healthcare services at almost no cost. Yes, so it's more like when you're ill, you can just walk into any of the hospitals and then you have access almost at no cost because you have done all of the premiums already at the back end. So yes.
Great. Okay, so I'm not going to go into too much nitty-gritty because I know your forte is the drug access part. But for those who have been, following us, about the plans, about 10 of them. 11 now. Seven, okay. My PR on the back end just giving me a bit of correction there. I know we have the standard plan, standard plus plan. We have the seniors plan. We have the tertiary plan. We have school plan. We have telemedicine, diaspora. Okay, that's about 7. Is anyone missing? Okay, so we'll definitely give you more information as regards this, and like my guest said, at little or no cost you'll be able to access this. And for those who have been following the show, we had a testimonial last week, really mind-blowing, where our guest came and he talked a lot about his experience with ILERA EKO, and so for any one of you who perhaps needs more information, we'll definitely afford you that. But moving ahead, we're talking ILERA EKO, expanding drug access. I'd like to know, pharmacist Tolashe Deolua, how many facilities are now under ILERA EKO? How many do we have at this time?
Okay, so currently we have over 350.
Over 350?
Yes, spread across Lagos State.
Okay. And are they only public hospitals or public facilities?
Both public and private.
Public and private?
Yes.
Oh, so perhaps anybody who perhaps doesn't want to go to a government hospital can actually choose to go to a private institution.
Yes, they can.
And still access quality care.
Very well.
Okay. So as regards today's topic, can you intimate us what's the idea behind expanding drug access?
Okay, thank you so much. So as an agency,
yes.
we seek to expand and do more towards increasing our provider network.
Okay.
So yes, we know we have the hospitals, we have eye clinics, we have dental clinics, and we just felt, okay, let's also do an expansion in terms of drug access. Let's bring in community pharmacies also into our provider network.
Community pharmacies, when you say, what does that mean?
So community pharmacies are pharmacies that you would see within your neighborhood.
Okay.
So they are the ones that they are usually on your streets, within maybe outside of the hospital vicinity. Yes,
okay.
you would see them there.
Where you can
so you can just walk in,
drugs.
You can get your drugs there.
Okay, so now I'm wondering, so if you go to some communities or you go to some places in Lagos, you come out, you see some, maybe you face an drug, are those kind of chemists we're talking about?
Okay, so no, we are not saying chemists.
Okay.
We are saying accredited pharmacists with the Pharmacists Council of Nigeria.
Okay, so how do we get to know which ones are, under this scheme? Yeah.
So the list of these pharmacies will be available on our Lashma website.
Okay.
It will also be available on our customer app.
Okay.
We would also make it available at the hospitals. Also, then the Lashma customer service would also be available to guide you on the closest one to you. So yes, it will be readily available.
Yes. Okay, great. Okay, so now, my dear listener, I see our phone lines already blowing up. Some people are already trying to connect with us. So do call 080 991-20777 and 091-538-77127. The calls can start coming in. I had to allow my guests, give us a bit of information before we open the phone lines. Do know that, of course, for those who won last week, you can call in to give your testimonial. We're doing another giveaway today. Yes, bigger and better. So the first two callers on the show will be having free recharge. Yes, confirming. Is that true? Yes. So free, we are going to be recharging your phones, the first two callers, and we also have quiz questions. So apart from the first two callers, we also have quiz questions, and I'll be giving free recharge. I'll be recharging at 1,000 naira each to two lucky winners. So in total, that will be four. Is that correct? 4, 2. Okay, 2. First two callers, then how about the quiz questions? We'll have 2 winners from there too. Yeah, so that's 4. Okay, let's take this call. Has been calling. Hello, good morning.
Hello, good morning.
Yes, your name and location, please.
My name is Ruth, and I'm calling from Egbeda.
Ruth from Egbeda. How is Egbeda this morning?
Yeah, it's fine. Doing well.
All right. So, Ruth from Egbeda, do you have a question?
No, I don't have a question. I just want to greet the guest and greet the presenter too.
Okay, great. Thank you very much, Ruth from Egbeda. Okay.
Oh, thank you, Ruth, for calling in.
Okay, so automatically you're our first caller, so you actually get to go home with 1,000 naira recharge card. Yes, so I'll take down your number. Of course, this is your number. It ends with 676. Is that correct? Hello, Ruth. Okay, Ruth, congratulations. You won 08099120777 and 091-538-77127. So, first two callers, you'll be getting something from me, and I have quiz questions. Feel free to connect with us. You can also get gifts from us. Okay. So we're continuing with our 1,000 naira free recharge cards for our first 2 callers. We're also having our quiz, ILERA EKO quiz, and the first 2 winners only will have free 1,000 naira recharge cards. Okay, so we're talking ILERA EKO expanding drug access, and my guest has been able to tell us that of course they've expanded the reach to the registered pharmacist around our vicinity, and you can access the website and then ILERA EKO customer care to be able to know which ones are accredited. So is it I want to know, so all enrollees, is it all ILERA EKO enrollees, all those who are enrolled on the scheme that need care at the hospital, is it all of them that will have access to this?
Yes.
Okay.
All ILERA EKO enrollees would have access to this.
Okay, so it doesn't matter your plan?
No, it doesn't matter your plan.
Oh, great. Okay, so I'd like to know, how will this work? Tell us more about this. How will this work?
Okay, so I would give you a scenario. So you know the way that there are many markets in Lagos,
yes,
and there's some that are they are known for particular things.
Okay.
So let's say you go to K2 Market and you want to buy fruits, or you go to Maltoba and maybe you want to buy pepper and all of that.
Yes.
So what we are doing is that in expanding it, we are saying that if you don't find something here, you can find it here.
Okay.
So it's not like we are shutting picking up your medications from the hospitals. What we are doing is that we're expanding it. So if they don't have it here,
you will always get it
also
here.
Get it here. So that's really what it is about. So that at the end of the day, our enrollees are satisfied that yes, I can pick up my medications at any of these possible locations.
So availability will not be a problem.
It won't be a problem.
Hello, good morning. You're welcome.
Yes.
Yeah. Who are we on to?
My name is Adra from Ogun State.
Come again?
Adra from Ogun State.
So that's not Adra or something. I didn't get that. What's your name, sir? Please, could you tell us again? Hello? 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 Oh yeah, so I only heard the Ogun State part. That was the clear part. So do call back. I'd like to hear what you... I heard Ogun State, so call back. So I want to know, what about if the pharmacy that I decide to get these drugs from, now we're talking availability, what if I get there and also discover that they don't have this drug? But let's hold that thought. Let's see if we can take this. Hello, good morning.
Yes.
Yes.
Adra.
So I was not wrong. You're welcome from Ogun State. Okay, so talk to me.
Yeah, people in Ogun State, can they enjoy from ILERA EKO?
Okay. People from Ogun State, can they?
Yeah.
Okay, so it's
maybe on the outskirts of Lagos.
It's for Lagos State residents.
Okay.
It's for Lagos State residents.
So, Adora, you have also automatically become our second caller, so you get to get something from us, recharge card. Yes, so congratulations to you. Thanks for calling. Okay. Oh, someone is accusing us on... Okay, so you don't respond to messages. Send your message, we'll respond. 080-991-20777 and 091-538-77127. I still have giveaways for those who can answer my quiz questions. I still have quiz questions, so feel free to call in. We'll definitely love to hear from you. So I was asking a question. What if I decide to get the drugs from the pharmacy and I get there and they do not have them? What do I do?
Okay, so it's still the same way, like you go to the market and sometimes you don't find something in one market.
Okay.
And you go to the other one.
Okay.
So it's really going to still be the same way.
Okay.
Even though, yes, would try as much as possible to see that it's a one-stop shop so that you don't have to, but then the possibility also exists that you might need to go to another one. So it's really just the openness that you would always find it at one point.
One.
Yes.
Okay. If one doesn't have, you could go to the other. Hello, good morning. Good morning. Hello. Hello, good morning. Okay, I don't know what's up with our connection today. Please try, keep trying. 080-991-20777 and 091-538-77127. You can call in, you can ask questions, but also I have questions for you. And if you get any of my questions, I'll also have a gift for you. Today we're talking ILERA EKO, expanding drug access, where of course my guest has been able to, throw light on the fact that aside the hospitals and the other care health providers, you can also walk into an accredited pharmacy to get your drugs. And in the case where one does not have, you can always go to another one. Okay, so does this mean, like, say someone who is like an outpatient, you were not admitted? So is it that the hospital that I use will no longer, give me drugs or dispense drugs for me?
Okay, so the way it will work is that, of course, if it's an emergency case, the hospital is still going to deal with that.
Yeah, okay.
If it's an inpatient, you're on admission, the hospital is going to deal with that.
Yes.
If it's you need to take injections, also the hospital is going to deal with that.
Okay.
What we are doing is purely outpatient oral medications with the community pharmacy, because of course we do not want our patients to have to first walk out and then come back into the hospital to take the injections. That would absolutely make no sense at all. So yes, it's for the outpatient oral medication. So that means even after your admission at the hospital, if you have to take home drugs, orals, yes, you pick it at the community pharmacies. But then we are saying that even you can pick it also at the hospitals. If it's available there, then pick it up there.
By all means. Hello, good morning.
Good morning.
Yes.
Akan, good morning.
Your name,
my
please.
name is Adiola.
Adiola. All right, please go on.
Yes. I just want to commend the Lagos State government for initiating this project, this health scheme. I actually am about to be a beneficiary of this health scheme. I'm still
Wow. Hello? Okay, I think the line went off. He said he's about to be a beneficiary of the scheme. Hello, Adiola, if you can hear me. Okay, so could you call back so that we could get this clearly? But from what I gather, hello, can you hear me now? Oh dear. 080-991-20777 and 091-538-77127. Adiola, please call back so we can get the full import of what you're trying to relate. Okay. So okay, I think he's trying to call back. Let's see. Hello.
Yeah, I'm back again. This is Adiola.
Yeah.
Yes, as I was saying earlier, I think the network was really bad.
Yeah.
I said I really commend the government for bringing out this initiative. I am one of going to be a new beneficiary of this scheme because I want to go into it, which I've already started to do payments maybe today or tomorrow. Okay. So I don't know if I may ask a question. Can I choose any hospital between my axis, especially private hospital?
Okay, so let her respond to that.
Yeah, so as long as the hospital is within the ILERA EKO provider network, yes, you can pick private or public. Yes, you can pick.
Okay, so Diola, I hope that's fine. You can choose a hospital. You can pick a hospital as far as it's within your vicinity.
And it's also
within the provider network. Okay, so and of course at the point of registering and payment, he will definitely be afforded the list of all hospitals within reach.
Yes.
Unfortunately, Adiola didn't stay for me to ask him my questions. Okay, but Adiola, if you'd like to, be part of that, do call back so I can ask questions. And for you out there who's listening, call in so you can, win something. Okay. So do call in so you can win something. 091-20777 and 091-538-77127. This show is also live on Facebook, Lagos Traffic Radio 96.1 FM. And we're also live on YouTube. That's Traffic Radio 961. We're talking about expanding drug access under the ILERA EKO scheme, of course. And we have with us pharmacist Tolashe Adeolua, who of course has been, she's a medical supply and logistics officer with Lashman. She has been, light on this topic of moves by the Lagos State Health Management Agency to expand drug access. At this point in time, aside the hospital and other facilities, you can actually step into a pharmacy, well, I say community pharmacy in and around your vicinity and still access drugs, So So how will the community pharmacy that I choose to get my drugs from know that I'm an enrollee under the scheme, and how will they know the specific drug to give me? Will I give them the prescription from the doctor, or how will that work?
Oh yeah, okay. So every enrollee has an ID number, which is unique to that enrollee. So that's still the number that will be used even at the community pharmacies also.
Oh, so they also have access
yes,
to
they have access
pull up
also
the information.
Yes, so the ICT portal also has that workaround where the enrollee ID would also pop up, and then your prescription will pop up. We're also looking at ways where we can also do the hard copy prescriptions that will go side by side. Okay. Both online and hard copy.
Let's just take this one. Hello, good morning.
Hello, good morning.
Yes, so who do we have on the line? Hello? Hello? Oh dear.
Hello?
Yes, good morning. Who's on the line?
My name is Blessing. I called last week. Can you hear me?
Yes, I can hear you. Let's from last week.
Yes, I called last week.
Yes.
Yes. I was part of the caller that won the charge.
Oh, okay.
Yes.
Great.
Yes.
Congrats.
Yes, I just want to say thank you. Thank God bless. And I love the ILERA EKO plan. And I've discussed it with my husband, and he said that it's going to do it for us.
Okay, great. Okay, so seeing as you're still online, would you like to play any of our, ask our quiz questions? Would you like to try?
Yes. I'll try.
Okay, so I have, let me see. I have, this is 5 questions. Number 1 to number 5. So you can pick any of the questions.
Okay, let's go for lucky one. Number 1.
Number 1. Lucky one. Okay, so you've been following the show, although we've not spoken about it today, but we spoke about it last week. How much is the ILERA EKO standard plan?
ILERA EKO standard plan. I think it's 5.
Is that correct? I'm asking my fiancé here. They said it's correct, though. Congratulations. 8-5.
That's thank you so much.
For the individual plan, okay. For the family, how much is it? Do you have an idea? That's what the individual, 8-5 is individual, I've been told. So for the family, do you have an idea? Do you know? She got it, Abby. all right, don't worry, we'll give you this one. Congrats, okay. Congrats. Somebody that won last week, are we going to allow us to win again? No. Okay, so we'll give it to you. Congratulations to you. So I still have one more. 080-991-20777 and 091-538-77127. Hello, good morning.
Good morning. This is Adiola again.
Adiola calling back. Welcome. Okay, so Adiola, would you like to be a part of our? Would you like to answer any of our questions?
Let me give it a shot.
Okay, give it a shot. I have number 1 to. Okay, 1 is gone. So number 1 to number 5, but 1 is gone. So you have 2, 3, 4, 5.
3.
You did Kalu first. 3. Okay, so this is really simple. If you've been following this, you definitely know who I'm talking about. What is the name of the permanent secretary of LASHMA? What is the name of the permanent secretary of LASHMA? It's a name they mention every time, even when we come on the show. Most of our guests, they will always say, I want to say kudos to blah, 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 blah. So could you answer that?
I can't just remember. I can't remember.
Oh dear.
I feel this one.
All right, Adiola. Thank you for calling. Okay. All right. Do have an amazing day. 080-991-20777 and 091-538-77127. Okay, I can see. This is hello.
Hello. Yeah, sorry. The next, this is Blessing. The network was bad. I couldn't hear you.
Okay, don't worry. They've already given it to you. You won. Don't worry. Okay.
All right.
Congrats.
Thank you so much. Yeah.
All right. Okay, so back to expanding drug access. So you established that the community pharmacy that I choose to get my drugs from, they will have access to be able to, from that's of course from my policy number, right?
Yes.
They'll be able to pull up the information and know, okay, is it that the doctor would have imputed
exactly
the information
from
and the
the
drugs
hospital.
I need, so I don't need to carry a prescription.
You might need to.
Okay.
Just because we understand that technology has downtimes also, so that those downtimes don't affect your access to healthcare.
Okay.
Yes, we will do it side by side.
Okay, pari passu. That's great. Okay, so a quick look at the traffic situation from our live camera feeds. I can tell you that movement around, let's see, Maryland axis for those coming in from the Anthony end. Service lane coming inwards Maryland. Aside from traffic light alternation, you have nothing to worry about. By and large, it's looking really good. Oshodi Apapa Expressway, precisely around Northwest filling station, it is a very, very good one. I have a caller at this time. Let's see if we can take this. Hello, good morning.
Hello, good morning. How are you, sir?
I'm very well, thank you, sir. Who are we speaking with?
My name is Kayode Afolabi from Egbeda.
Kayode Afolabi, all right. Good morning to you. Yes, so...
yes, you are welcome, ma.
Thank you very much.
Sorry about that. Okay, she says thank you. Do you have any questions, sir? Hello? Mr. Kayode? Oh, yeah. I don't know what's up with the network today. Mr. Kayode, can you hear me? Mr. Kayode?
I've been well attended. So far, so good.
Yes, sir.
I've been well attended too. So,
okay. So, Mr. Kayode, can you say everything? Can you just take it all over again? The line went blank at some point, so we didn't really. Yeah.
I said I enjoyed ILERA EKO. I'm one of the beneficiaries.
Okay. Okay.
And it has been wonderful.
Okay.
I was given a very good treatment from the clinic I choose.
Okay.
So it has been wonderful.
Wow, amazing.
I want to appreciate the Lagos State government for that.
Great. Okay, and would you have any recommendation? Is there anything you feel they can improve upon?
Come again, sir?
Do you have anything you'd like them to improve upon?
Not really.
Not really.
That's been wonderful.
Wonderful. Okay. Mr. Kayode, I have some quiz questions. Would you want to partake? Would you want to try? And, you go home with a recharge from us, a gift from us. Just a way of saying thank you. Hello? The line has gone blank again. All right, Mr. Kayode, I'll be leaving that open for you. Do call back. So, of course, you can try questions. Okay, so back to expanding drug access. Now, you said we'll be able to also go with, the prescription so that downtimes, that also would, be handled. But I'd like to know now, this whole initiative, when will it start? When will it kick off? Or is it on already?
No, it's not. So it's starting officially 1st of April.
1st of April, okay.
Yes,
okay,
so from 1st of April 2024, yes.
That's in like 2 weeks.
Yes,
okay.
2 weeks.
Just after the Easter
yes.
break. Okay, great. So just after then, we'll be able to access the community pharmacy. Okay.
Yes.
Even as the show, comes to an end, I'd like to know what your advice to enrollees will be on this expanded drug access. This new initiative of LASHMA, and also generally to Lagos residents as regards
striving, day in, day out to improve enrollee experience and customer satisfaction. So come on board, register, buy a plan as it suits you, individual or family. Thank you for having me.
Help us, shed light on this very, very interesting and important topic. And we're all excited about the innovations that the Lagos State government through LASHMA is bringing, and it's nice that you all keep us in the pipeline. You give us this information as at when and we're all excited. Okay, so it's been a great time on the show, like I said, and of course we're looking forward to this and how we can access all this. Now, so before I let you go, let's have some contact information for those who need perhaps further information as regards this and every other thing as per ILERA EKO.
Yeah, all right. So you can reach out to us on our customer service lines. I will just call out the WhatsApp numbers.
Okay.
Yeah, so it's 0704 53 58 275 or 0704 61 651. Or you can call on our toll-free lines 0700 463 72356 or 0800 2755 27462. All our lines are open for you.
They're a bit fast.
Okay, so I would go over again. Okay, so the toll-free lines are 0700 4637 2356.
All right.
Or 0800 2755 27462 or via WhatsApp on 070 453 58275 or 070 461 651. The lines are open for everyone, and you'll be attended to.
Oh, great. Thank you so much for coming around. Thank you, and we had a great time on the show.
Thank you so much.
Yes, that no one should not have access to quality healthcare. That's why Lashma brings you this show every Monday. We appreciate your feedback and we don't take it for granted. So keep them coming in. Don't stop. And this is where we drop anchor today. The show will make a return next week, Monday at exactly 10:15. So till we come your way next week, just want to say thank you to Victor Terry. Also a big thank you to everybody, Adinka, sorry about that, PAO Lashma. Yes, a big thank you to you to be coming away next week. Do you remember your health is your wealth? Do get yourself onboarded on ILERA EKO. Bye for now. My name is Akan Usen.